as I was saying, my name is Sandra Arevalo. I'm the Community Health and Wellness Director at Mount Sinai Nyack Hospital. And thank you so much for being with us today in this community chat. We're going to be talking about insurance, Medicare, open enrollment, lots of things that I don't even understand. So I really hope that you can ask a lot of questions because the people who know are here to help us. Insurance, and especially health insurance, can be a little confusing, to say the least. And I think that, this is a great opportunity to answer all the questions that we have. And now I'm going to ask our panelists to introduce themselves and tell us a little bit about who they are, what they are doing here, and what they are going to be talking about today. So, Enriz, do you want to start?
Yes, hi, sure. Thank you, Sandra. My name is Enroll Ramirez. I'm the CEO of MCare One, and we are a national health insurance agency with network affiliations with AGA nationally. So we provide healthcare products, particularly for the Medicare space. We're contracted nationally with all the major insurance companies, and we have many agents that are providing healthcare information and healthcare enrollment in the Medicare space in multiple states. And we are here today to talk mainly about Medicare and basic information about Medicare, and also some information about non-Medicare insurance as well, as to where the population could obtain credible coverage and where they could obtain cost-effective insurance for everyone and every member of the community.
Thank you, Enriz. Janine?
Hi, everybody. My name is Janine Beck. I am a licensed independent broker. I am contracted with most of the major carriers. I'm licensed in approximately 10 states. I primarily focus on helping baby boomers, seniors with their Medicare plans. I help them enroll. I help them enroll in Part A and B. I help them find plans that best meets their needs and their budget. And I work with them on a yearly basis throughout the year. I'm available to them throughout the year. And we're all really here to help the senior community.
Great, thank you. Pam?
My name is Pam Kother. I am one of Janine's associates, and I live in the Nyack community, and I am excited to be here, and as well as Janine and Enriz, happy to answer any questions and help people if they have, to help them also if they have any specific needs that they are looking to have met, and guide anybody with anything. So thank you so much for having us.
Yeah, it's my pleasure. So just a reminder to our participants, you can ask all the questions you like. Just use the chat box and I will read your questions to our panelists. You can also use the Q&A feature. So you just click on the icon and you can write your question there. So lots of ways to interact with us and our panelists. So Enriz, I don't know if is there a certain way that you would like to start, but I do have a question though, probably before you start, because I think this is a question that a lot of people might have.
Yes.
We hear about Medicare, we hear about Medicaid, but then we also have all these other insurances, right? So being that we're going to talk about Medicare especially, like what is the biggest difference between Medicare, Medicaid, and all these other insurances?
Okay, great. So again, Medicare is a national health insurance program that is a government-sponsored program by Social Security. So it is a national federal program that everyone that is eligible, 65 and over, or individuals with Social Security disabilities less than 65 also qualified to receive Medicare. So Medicare is a national government-sponsored program from Social Security for everyone in the country. Medicaid is a state-specific program for individuals with certain certain needs. For example, low-income individuals that qualify for Medicaid, individuals with special programs or special disabilities that also qualify for Medicaid. So again, Medicaid is a coverage on a state level, and Medicare is a coverage on a national level for everyone that qualifies over the age of 65 and with disabilities. So as far as the other private insurance that is available, mainly a lot of carriers offer private insurance, group insurance, family insurance. So those are private sector insurance programs that are mainly related to family size and income levels of that applicant. So those are the main factors that insurance companies are always going to look for in order to provide coverage. So they look at the number of applicants, again, the number of household members that are applying, and they also look at the income levels of that household in order to qualify them for specific private insurance coverage and packages. Medicare is different. Medicare, again, individuals that are citizens or residents of the country, they actually work and pay into Social Security to obtain Medicare when they reach 65 years of age. So everyone that works in this country pays Medicare or Social Security taxes. And as long as you're doing that, again, for 40 quarters, which basically is roughly between 5 to 10 years, depending on the time frame of the applicant, then you will qualify automatically at the age of 65 to receive Medicare. So you already, most seniors in this country have already purchased, if you will, their Medicare coverage just by working in this country and paying into Social Security taxes throughout their working career. So that's the two main differences. Again, Medicaid is state sponsored, and Medicare is a federal health insurance program. So they work differently.
And being that Medicare is federal, if you live, for example, in New York, but you decide to move to Florida, that's the Medicare move with you, or you won't have to apply for a new Medicare in the new state?
No, definitely. Once you have Medicare, it's yours, right? So you have Medicare coverage anywhere in the continental U.S. or U.S. territories, Virgin Islands, Caribbean, Puerto Rico, Guam, Hawaii, anywhere in the continental U.S. and territories. Once you have Medicare, it's your coverage. Like I said, you've already earned it. You really paid for it already throughout your life, and throughout your working life, paying into Social Security. So wherever you move, it goes with you. What you do have to change, however, is the additional medical coverage in that particular state, because Medicare only covers up to 80% of your total medical coverage. So that additional 20% that everyone is going to need, that's what you need to kind of look into from state to state. Every state has different carrier programs, different Medicare products available from the different health insurance companies that will satisfy that 20% coverage. So the 80% that you have from Medicare, that will go with you anywhere in the country. Mm-hmm. And then once you get to where you're going, you have to kind of reestablish additional coverage in that state for the additional 20% that you're going to need.
Mm-hmm. Okay, that's very good to know. And okay, go ahead.
No problem. So again, I do have a presentation slide deck that I wanted to discuss. Is our Medicare one-on-one training and orientation tool that we use throughout the market. So I wanted to kind of share the screen and share that information. So am I okay to share my screen? Okay.
Absolutely.
All right, so give me 1 second and let me do that. Okay. Can you see my screen, Sandra?
We do.
Okay, very good. All right, so this is our Medicare one-on-one, understanding your Medicare plan options. And again, I'll be happy to email this to you also, and you could share this informational deck with anyone in your network and all the participants here on the chat as well. It's basic information, understanding all your options. This is sponsored by AGA. And again, AGA is our national Medicare organization that provides contracting for all our agents and agencies across the country to offer Medicare products from all the health plans in the country. So our team is contracted with AGA to provide this information. So we'll talk a little bit about this. I'll kind of go through it in a pretty steady fashion. If there's any questions, Sandra, that you or any participants have, please let me know, and I could stop at any point and answer any questions. Okay.
Great.
All right. So again, who's eligible for Medicare? We talked about that briefly in the intro. So this is basically the same information, reinforcing that. So everyone 65 and older is eligible for Medicare, as long as they have U.S. citizens, and as long as they are permanent residents for at least 5 consecutive years, they will qualify to receive Medicare. And it comes automatically. So also anyone with disabilities under 65 that are receiving Social Security disability insurance payments for more than 24 months, regardless of age. So they are children that have Medicare. So there's plenty of under 65 individuals that also receive Medicare for various disabilities, and also including mental health as well. So the scope of qualifications for disabilities have expanded over the years. So now there's more and more disabled individuals for different categories that do qualify for Medicare. They will start with Social Security disability. That's how they start if they are less than 65. And then once they complete 24 months of Social Security disability status, then at that point, they will receive notification from Social Security that they now qualify for Medicare. So that's the other segment of the population that also receives Medicare. Again, when it comes to illness, there's mainly 2 different illness categories that also receive Medicare. So anyone with end-stage renal disease, which is kidney failure, they will also qualify for Medicare, and also anyone with ALS as well. Okay, so then.
One question regarding the disability. You were saying that Medicare covers 80% of the cost of your medical costs.
Correct.
What is the difference, or is it the same when you have disability?
Yes, Medicare covers 80% for all Medicare beneficiaries. Now, what happens in most cases with anyone receiving SSD, Social Security disability, they will automatically receive a SSD level Medicaid. So Medicaid then comes in and covers the other 20% for those individuals with disability qualifications, because that's kind of like an automatic application. So anyone that receives Social Security disability will qualify to also receive Social Security disability Medicaid coverage. So they will be able to apply at that time, and most individuals under this category, the application is submitted simultaneously at the time that they qualify for Medicare. So once the 24 months have elapsed, then at that point, right prior to the 24 months, what happens is that everything gets uploaded for that member for Medicare coverage, and they will receive notification that they qualify for Medicare, and they will also receive notification that they also qualify for disability Medicaid coverage to go along with their Medicare. So it's kind of a specific qualifying category for these individuals. And so yes, so to answer your question, everyone receives 80% coverage. And then again, there are certain programs and certain criteria that will follow to qualify individuals for the Medicaid coverage. People with special needs will automatically qualify for Medicaid. So the special needs category falls also for disabled. So anyone with Social Security disability will automatically receive what is called a special needs classification. So they will qualify for Medicaid.
Excellent. And we have a question. I think you've answered this already, but in any case, will Medicare be the primary insurance if patients also have Medicaid?
Yes, unless they have a Medicare Advantage plan, and we'll talk about that in the deck. There's a page that discusses that a little bit. So yes, if they have Medicare and Medicaid with no Medicare Advantage and no Medicare Supplement, then yes, then Medicare becomes their primary insurance, Medicaid becomes their secondary insurance. And then that particular member will also need a prescription drug coverage because Medicare does not provide prescription drug coverage. So anyone that receives Medicare and Medicaid, they will have to enroll into a standalone prescription drug plan, or they will have to then enroll into a Medicare Advantage plan, which offers the Part D, which is the prescription coverage. So they will have an option. Most individuals with Medicare and Medicaid, they do have that option. They could either stay with Medicare and Medicaid and then choose a Part D plan so they could have coverage for their prescriptions, or they could enroll into a Medicare Advantage plan, which most of them today have the Part D included in their coverage. Okay. All right. Okay, good. Excellent question. So moving along, again, when you turn 65, you automatically are enrolled into Medicare. You receive a Medicare card 3 months prior to your birthday. You will get that notification from Social Security. They will send you all this information about 90 days prior to your 65th birthday. And there's different ways you could enroll and join Medicare. These are the 3 ways that you could do it if you're going strictly to Medicare alone. So if it's, you could go apply in the Social Security website, or you could call Social Security directly. When you're coming up to your 65th birthday, you could contact them directly, and they will send you the information, or you could simply apply by going to any Social Security office prior to your 65th birthday and apply for Medicare. So mainly what the rule of thumb is that if you do not receive, if you're 64 turning 65, and if you do not receive notification from Social Security within 60 days of your 65th birthday, then the advice will be to contact Medicare using one of these 3 formats. So that sometimes, again, unfortunately, some patients do fall through the cracks. Social Security does an excellent job in reaching out to almost everyone that does qualify prior to their 65th birthday, but there has been cases where some individuals don't receive the notification until after their 65th birthday. So the rule of thumb is if you haven't heard anything from Social Security prior to your, at least 2 months before your birthday, definitely be proactive, contact Social Security, let them know, and they will go ahead and send you that that package so you could start your Medicare coverage. Okay. Okay. So the parts of Medicare, there's always questions about the parts of Medicare and what part covers what exactly. So this illustration kind of breaks it down a little bit. I know it says 4 parts right here, and then this slide shows 5, but let's not get confused. Medicare Supplements, it's not really a part of Medicare. It is a coverage for Medicare. So the 4 parts of Medicare is Part A, Part B, Part C, and Part D. Those are the official 4 parts of Medicare. Medicare Supplements is a Medicare option that Medicare members have to receive coverage for the other 20%. So we'll talk. Yes.
Yeah, sorry to keep interrupting, but you know, for those of us who have more of a private insurance, right? You're saying, okay, before 65, ask for the package, apply for Medicare. What would be the advantage of applying for Medicare versus keeping with the same insurance that you've had?
Okay, well, there is a number of advantages. So let me just kind of highlight the most common ones. Number one, if you are working, if you're still working at the age of 65, then you do not have to enroll or participate in a Medicare Advantage plan or a Medicare Supplement plan, but you are 65, you could still use your Part A of Medicare, so you still have access for hospitalization coverage and still be working and still receive your coverage that you're getting from your employer. So again, if you're still working at the age of 65 and you are paying for medical insurance coverage through your employer, then yes, you have the option to stay with that coverage until you retire. Then once you retire, then you can move forward, get the Part B of Medicare. Otherwise, you will be penalized if you don't. And again, we will talk about the penalties in a minute. Is also part of this presentation as well. So the system is kind of designed to transition everyone that is aging into Medicare, transitioning them into Medicare. That's the way the system is kind of designed, because private coverage after the age of 65 is very, very expensive. And if you're not working anymore and you're retired, then again, you qualify already for Medicare, which will cover that cost for you. If you don't do that and you choose to pay your own private coverage, you can. And there's definitely plenty of senior members that choose to pay for their own coverage or for their own private insurance or for high premium Medicare supplement plan because they could afford to do that. But again, it really depends on the need and the financial resources of that beneficiary. Most seniors are working with a fixed income, with a fixed budget. And again, the cost of health coverage does increase on a yearly basis. So it is definitely an option and a good option for these beneficiaries to get cost-effective coverage for their health care. And that's where Medicare, along with Medicare Advantage plans and along with Medicare Supplement plans, that's where they come in. They pretty much help to manage the cost of healthcare for these retirees that are within these fixed budgets. But again, it's not exclusive. There's individuals that have good resources. They could afford to pay private insurance regardless of age. So they could do that. And again, those premium packages for those coverages above 65 could be quite expensive. So there is options, right? It's not one clear choice for everybody. There is plenty of available options, and that's where the agents and the Medicare agents, that's where they come in and bring value, because most Medicare agents and health insurance agents, they are trained to do what is called a needs analysis, sit down with the potential members and kind of determine what the needs of that patient are based on their income levels, based on their geographical residence, where they live at, because again, these packages change from county to county, from state to state. So the cost of healthcare definitely changes based on those factors. So this is, again, what we do. We sit down with the clients, we discuss these things. We try to figure out the best way to match the circumstances and the needs of the potential prospect with the available options that they have to meet those needs. And that's in a nutshell, that is the main responsibility of the licensed agents in the Medicare and in the health insurance space. That's our main focus, is to make sure that we provide a benefit overview with the clients and kind of discuss what their needs are, what the medications are, what their hospital preferences are, things of that nature. And based on those responses, we could then match the available products in their market with them and give them options for their healthcare coverage. Okay, so that's basically how this works. But again, did that answer your question, Sandra?
Yes,
Hello?
perfect.
Okay.
Yeah,
okay, great. So let me just, again, real briefly discuss these parts of Medicare and what each of them cover. That's always a topic of discussion all the time in our presentations, because you'd be surprised on the number of patients and members that just simply don't understand what each part of Medicare covers for them. And it's quite a lot. So let me just basically take a step back and just go section by section. Okay, so on Part A is mainly hospitalization coverage. So your Part A of Medicare, which everyone at the age of 65 will receive automatically. So hospitalization coverage means inpatient hospital care, skilled nursing facilities, hospice care, and some home care services. It says here limited home care because, again, home care is expensive, and for the most part, Part A does pay a portion of it, but you must have Part B and other credible coverage to really have long-term home health care services. But inpatient hospital care is the main focus of Part A. So when you go into the hospital and you are admitted in the hospital as a Medicare member, your Part A covers the cost of your hospitalization. Okay, so that's the main coverage for Part A. For Part B, again, for Part B is outpatient coverage. So all your doctor visits in your outpatient center, or your private family doctor, or your internal medicine doctor, anyone at your community level that you go see, your primary care physician, and any specialist that you see outside of the hospital, right? Your cardiologist, your podiatrist, nutritionist, all of those different specialty fields outside of the hospital, that's all outpatient care. So all of that is covered by the Part B of Medicare. Okay, outpatient surgeries, diagnostic screenings, like x-rays and lab work, blood work, all of that, that's covered by your Part B. Emergency care is covered by your Part B. So every time a Medicare member that has Part A and Part B goes into the emergency room, the Part B is the primary coverage that covers the emergency room visit, along with any other coverage that member may have. And of course, durable medical equipment is also covered by Part B. So again, if you're a Medicare patient and you need a wheelchair, a specialized bed, or any support equipment in your home, all that medical equipment is covered by your Part B of Medicare. Okay. And then Part C, and let me just talk a little about the Part B premiums, because I think it's important to note that Part B is not free. Part A, you earn. So Part A, you earn it because you've been paying into your Social Security throughout your life. So you earn that automatically at the age of 65, or when you complete 24 months of disability. But Part B, it does have a cost to it. So as you can see here, if anyone is receiving less than $91,000 as a single person per year, then the premium cost for your Part B is $170.10, which is automatically deducted from your Social Security payment. So Social Security will deduct this particular premium that you see here on the right, depending on your level of income. They will deduct this amount from your Social Security benefits on a monthly basis, so that you could pay for your Part B. Now, there are other programs that help with this cost. There's some other discount programs that are available from some of the carriers. Some of the health plans do offer Part B payback offers where they could pay a portion of this for you if you enroll with their carrier. Then you have also a program called Medicare Savings Plan that also provides assistance with paying for the Part B premium if the person qualifies. Now, the Medicare Savings Program, it is a income-based program, so they do look at the member's income per month, and if you fall within the guidelines of their limits, then you will be able to get your Social Security Part B premiums paid for by your state Medicaid or your state Medicare Savings Program. Now, there's a lot of information about that. You could easily go to medicare.gov and get that information. You could also just go into Medicare Savings Program and do a Google search on that. And it will also give you more information on the income limits per state that will qualify you as a Medicare member to receive your Part B reimbursement from the state. So I will just defer to that, to each state website, so that you guys could get additional information for that. But there is a cost. I wanted to show this because there is a cost associated with Part B Medicare, and it does come from your Social Security payment. It is automatically deducted for you. There is, again, late payments enrollments on this. So late enrollment penalties for Part B are also in place. Again, the system is designed to transition Medicare members from their regular coverage through that they have up to the age of 65. Most private insurance coverages will cover someone up to the age of 65 at a certain rate. Anything above that, the rates will go extremely high unless you transition into Medicare. And the system is kind of designed to transition these patients directly into this program. If you don't do it when you qualify to do it, then there will be a penalty for you for not having Part B. So again, if you did not sign up for Part B when you first became eligible, and it's not covered by your employer, because again, your employer will not cover Part B for Medicare for you after 65. So you have to, once you choose Part B from Social Security, you have to pay for that Part B premium from your Social Security payment. Now, you can delay your Part B if you're still working. So if you're 65 and you're still working, and you don't have to choose Part B. There's no penalty for you as long as you're still working and paying into your Social Security benefits by paying your taxes. But the moment you retire and you're no longer receiving coverage through your employer, then from that point on, yes, you become eligible to your Part B, and you have to choose and enroll into Part B at that time. If you don't, then there will be a penalty that Social Security will charge you as long as you don't have the Part B. So the longer you go without the Part B, when you are eligible to get it, then you will be paying a monthly late enrollment penalty. Okay, so it is definitely advisable to everyone that once you retire and once you're no longer working and you eligible for Social Security, then it's definitely advised that you enroll in Part B to avoid the penalties. Okay.
How do people know that they need to enroll in Plan B? Like, for example, this is new to me. I would not know if I hadn't heard you today. Thank God I'm not close to 65 yet. But you know, does the government send a letter or some type of information saying, you know, you're close to 65, this is what you need to do?
Yes, absolutely. So yes, absolutely. Everyone receives that information. So everyone that's eligible for Medicare, again, prior to their 65th birthday, they will be receiving all this information. And they also, again, there are some exceptions, because if you have credible coverage already through any special enrollment periods, then you don't have to pay the Part B. So there are some exceptions, and all that list of exception categories, all of that information will be sent to every person. It's also available on Medicare.gov for anyone that needs to look into it. But yes, to answer your question, Social Security does send that package to everyone. Unfortunately, the most members, they do go through the package and understand it and sit down with a caregiver to explain it to them. But unfortunately, there's some members that just ignore the information. It is a lot of information. These packages that are sent by Social Security are a lot of paperwork, and it could be maybe 10, 15, 20 pages long. And unfortunately, if that Medicare person doesn't have someone to sit down with them to review these things and explain it to them, most of them just won't know. And again, that's another function of the agents, of the insurance agents. One of our functions is to make sure that we sit down with our members and explain these things to them, and just kind of read that information for them and just help them, guide them through this process. It's a lot of information. I get it. And unfortunately, Medicare beneficiaries, they get bombarded with a lot of mail pieces every year. They get letters and packages from every insurance company out there. They get information from Social Security. It's just a lot. And I know, because I'm a caregiver. I take care of my dad, who's 80 years old, and I'm the one that has to sit down with him and read everything that comes in, explain all that verbiage to him, because it's quite confusing. So yes, I understand your question, and it is a concern, because there's a lot of information that gets sent out to these members. And by themselves, it's just hard to navigate. It's really hard to navigate all of that on your own if you are 65 and over, or and you have certain conditions, then yes, it's difficult. So again, the advice is definitely sit down with your local insurance agent if you have one. Give them a call, let them know that you would like to have more information, and they will be happy to make an appointment with you and explain these things to you, or have a caregiver, someone in your family or a neighbor or maybe a social worker or someone in your senior center that you participate with, someone that could actually sit down and go over this information when you get it. Everyone will get this information in the mail. And again, it's important that they go through everything so they can understand the consequences of not choosing or not enrolling into some of these coverages. Unfortunately, there is two penalties. There's one for late enrollment into Part B, and there's also a penalty for late enrollment into Part D for prescription coverage. And that one, we also have that. I have a slide around here for that right here as well. So we'll talk about that briefly in a minute. But yes, those two items are important. Part B and Part D, there is penalties that are established by the healthcare industry and the Medicare industry. These penalties are every single month, and they if the members don't choose these coverages when they are supposed to and when they are eligible to choose them, then yes, there will be penalties for these members on a monthly basis. So that's very, very important because obviously that affects the financial status of that member. So it's important to know these things.
And does this information that people start receiving in the mail come only in English?
Well, it always goes out in English. However, depending on how the member applied for Medicare. Now, if the member needs information in Spanish or in other languages, they are available. So all you will have to do, let's say if you are a member that speaks a different language and don't quite understand the English documents, yourself or a caregiver for you can always contact Social Security and explain that to them and let them know the language that you need the materials in, and they will be happy to mail you out the packages in that language. They do have it in multiple languages. So I think normally when a person applies for Medicare and they receive their original package, there is on the form, on the actual form, you could select a language and mail that back to them, or you could call in and select a language that you prefer the information from them. And from that point on, they will make an update on your file and they will start sending you information in your required language. So yes, it's a proactive situation though. It doesn't happen automatically. So there is an action requirement from the member side to let Social Security know what language they need. Okay. Yeah. The default language is always English. So there is an action requirement there. Okay. Okay. So real quickly here, the original Medicare, what they don't cover, right? So we talked about original Medicare generally covering 80% of hospital and medical expenses. But these are the items that they don't cover. So they don't cover deductibles. They don't cover co-pays and co-insurance. They do not cover outpatient prescription drugs. They will cover your medication and your inpatient drugs in the hospital, but not outpatient prescriptions in the pharmacy. Okay, healthcare outside of the US, it doesn't cover that either. It doesn't cover hearing aids or hearing exams or hearing screenings, and it does not cover routine eye exams, and it doesn't cover eyewear coverage or eyeglass coverage. Again, this is why a lot of Medicare members are now moving more and more away from traditional Medicare into Medicare Advantage plans, because most Medicare Advantage plans now offer additional benefits, including all these items here. So they will get the 80% from Medicare, plus they're in the 20% that the Medicare Advantage plan covers. It will also include their co-pays, their deductibles, the Part D for their prescription, worldwide coverage. In some cases, if you travel out of the country, you could get emergency care coverage and prescription coverage outside of the country. And some carriers also cover hearing aids, annual preventive exams and screenings. They also give you allowances for eyewear, glasses, dental coverage, things like that. So all of these other coverages that original Medicare does not cover, Medicare Advantage does. And that's why many, many members are going more and more now into either Medicare Advantage or Medicare Supplement, because those two coverages, they do cover some of these costs.
Henry,
Okay.
let's say I'm 65, I just chose the regular Medicaid or Medicare, I mean, and then a year from now, looks like I need a hearing aid. Can I change to Advantage?
Yeah. Yes, absolutely, absolutely. You could do that every year. So there is enrollment periods for everyone with Medicare, and that happens every single year. There's different enrollment periods where you can change your coverage, enroll into a different plan that fits your needs. So yes, so the answer to that is yes. You're not locked in forever. So the good thing about the Medicare products that are available today is that it allows options to the Medicare population on a consistent basis. So every year there's 4 and sometimes 5 enrollment periods depending on the client, where different times throughout the year that member can choose different coverages. Okay. We'll talk about that briefly here too. Again, Medicare Supplements is basically it's basically coverage to take care of the additional 20% for the member. And again, it does cover deductibles and co-pays and co-insurance. It gives you the freedom to choose any Medicare appointed doctor in the country. It's not restricted to network. So that's one of the advantages of Medicare Supplements, that as long as the providers accept Medicare, you could basically use any doctor or any hospital, any outpatient center throughout the country that accepts Medicare. They do have standard associated benefits. So every Medicare Supplement plan has a list of standard benefits that they offer. They all pretty much offer the same based on the category. The difference is the cost. So it depends on the premium per month. But the good thing about Medicare Supplements is that you pay a premium for that package, and you don't really have to worry about anything else from that point on. You are fully covered with 80% of Medicare. Medicare Supplement pays the other 20% as long as you're paying the monthly premium. And then you will have to choose a standalone prescription plan, because most Medicare Supplement plans does not offer prescription coverage. So that will give you the full coverage, if you will, that you will need if you choose a Medicare Supplement plan. And they're excellent. There are many, many excellent Medicare Supplement plans. And our experience tells us that it's a desired market in terms of a specific niche due to the income resources that you're going to need, right? There are plenty of low cost or free premium packages on the Medicare Advantage side, but all Medicare Supplements will have a monthly premium cost. And that varies from state to state, and it also varies from plan to plan. And they could go from less than $100 per month all the way to more than $300 a month, sometimes $400 a month. It depends on the coverage and the state that you choose.
And I guess, I'm sorry, and I guess you have to pay according to the state you're currently living in. Like, for example, let's say if it's cheaper in PA, I cannot go purchase something in PA while living in New York.
Exactly. But I'm not sure. Janine, if you are there, I know you have more experience on the Medicare Supplement side. Maybe you could answer that question. The question was that, can you enroll into a Medicare Supplement plan from a different state besides your resident state?
You usually you enroll in the state that you're living in. There was a carrier that you were able to enroll in a supplement plan. It was out of state, but they just discontinued it for New Yorkers or for any out of state. So yes, you need to enroll within the state that you're in. Now, if you enroll, say, in one of the major carriers that, and I'm going to give an example for United Healthcare. You enroll here in New York. United Healthcare supplements you can go to you can use in any state. Correct. So you don't have to change your supplement if you move. Correct. But there are certain cases where different states are less than New York, or vice versa. It depends on what state you're going to. So that's something that you would talk to your agent about, and they would look at the cost of the premiums and see if it would be best for you to move to another, a different carrier, or you will give them a change of address if you moved. You will notify the carrier that you have moved. And a lot of the carriers that do have supplements, they are in other states as well. But some, like in Florida, they have certain, like in New York, we have Empire Blue Cross Blue Shield, Anthem Empire Blue Cross Blue Shield. In New Jersey, it's Horizon. In Florida, it's a different carrier. So they're not all one and the same. So it's something that you would discuss with your agent. But normally when you do enroll in your plan, you're giving your home address, you're giving your zip code, and that's how we find plans for you.
Correct. Thank you, Janine. Appreciate that. Yeah. So yeah, for the most part, again, if you have a Medicare supplement plan, you could use your coverage if you go out of state. Your supplement coverage will go with you to, let's say, if you travel to any other state and you have to go to a doctor or a hospital or anything. That's one of the advantages of a Medicare supplement, that it does not restrict you to a specific network. It is open, and you could basically travel anywhere in the country and get medical coverage as long as they accept Medicare. So that's one of the pros, advantages of having a Medicare supplement plan. Okay. All right, so moving along here, again, I won't discuss this chart. This is just basically the benefit charts of the supplement plans. So what I wanted to kind of discuss is a little bit about what they don't cover. We talked about some of their advantages, but this is what they don't cover. They don't have prescription coverage. So you will have to get a standalone prescription plan along with your Medicare supplement. Again, and you will have to do that either through a prescription drug plan or any other credible coverage to cover your prescription. Most of them also don't cover, most supplements also don't cover, although that's changing now, but most of them don't cover eyewear or eye examination. Most of them don't cover dental coverage, but now you could actually add dental policies to most supplement plans now as well. So there are some restrictions with additional benefits that supplements do not cover as well. Okay, and then here we got Part D, which is the prescription portion of the coverage for Medicare. So again, Part D is strictly prescription drug coverage. That is what Part D is. And again, there's two ways of basically getting it. You could get it through a standalone Part D plan, or you could get it through a Medicare Advantage plan. And again, that's another reason why Medicare Advantage plans are becoming more and more popular in the Medicare space, because you basically get everything in one plan. You get your Medicare 80%, you get the 20% coverage from the carrier that offers you the Medicare Advantage, you get prescription drug coverage in the Medicare Advantage plan, and most of them also give you additional added value services like dental, transportation, over-the-counter benefits, 24-hour nurse lines, out of state and out of country coverage for emergency and prescriptions. So they do give you a menu of additional added services that traditional Medicare doesn't give you and that Medicare supplements don't give you. So this is, again, the differences between the two. So again, there's a big push in the last, I would say, I've been in the business over 20 years, and I could tell you that in the last 10 years, there's been a big push to and growth and market share for more and more Medicare Advantage membership. So the Medicare Advantage membership is growing at very large rates throughout the country because of the advantages of having all these additional benefits added into the package. One of the negatives of it is the network restrictions, right? So that's one of the items that most people look at with regards to coverage. As long as you are within your network or within your state, for example, then yes, then a Medicare Advantage plan works very well. And now most Medicare Advantage plans are offering more PPO services, which is more of an open network. You could go in and out of network, and you could still get all these additional added value services like transportation, over-the-counter benefits, dental benefits, things like that. You could still get those and still have a Medicare Advantage PPO coverage, which are really popular. Those are becoming more and more popular every single year. It kind of gives you the best of both worlds. You get all the perks of a Medicare Advantage plan without the network restrictions that a traditional HMO usually have. So that's basically the Part D is included in all Medicare Advantage plans. With Part D, all of them include prescription coverage in their packages. Okay. The cost varies again, as far as Part D premiums, the cost varies tremendously as well. And a lot of these premiums are usually included. So if you have a Medicare Advantage plan, for the most part, most of those premiums are included. So there's no cost attached to that. And then there's different co-payments with regards to the different levels of medication, whether it's tier 1, 2, 3, all the way through tier 5. So depending on the levels of medication, usually the first 2 tiers are either $0 to $3 co-payments. In some cases, a 0 co-payment, depending on the plan. And then again, tier 3s and 4s may have a higher premium, $8 to $12 usually. And then again, tier 4 and tier 5 are the more specialty items for medication. Those are more expensive. But the good news is that now with the new bill that was just passed recently, it actually allows for Medicare to now negotiate better rates for prescriptions. And so it looks like moving forward from this point on, there will be more discounts afforded for prescription costs, and programs like low income subsidy, which allowed discounts for prescriptions, will now have higher limits. And now the manufacturers of all these medications can now negotiate better rates, or I should say Medicare can now negotiate better rates and have more discounted rates for traditional drug costs. Before, they weren't allowed to do that. So, before, Medicare will have to basically take the rates that the pharmaceutical industry was actually giving them. Now, with this new bill, that's no longer the case. It will definitely allow more flexibility, more discounts, and better cost for Medicare members with regards to their prescriptions. So stay tuned for that. That should be taking place soon. For 2023, we should start seeing better cost, better rates at the pharmacy level for many, many members. Okay. Okay, so we talked a little bit about the Part D penalty, and again, there's also one of the parts of Medicare that does kind of transition you into it, and they basically force and put pressure into the Medicare beneficiaries to choose a Part D or credible coverage. Mainly, they do it to protect the cost factor of the Medicare member. They know very well that the cost of medications are very high. And if a member doesn't have a Part D coverage or a credible coverage for their prescriptions through Medicare, they know that that's going to affect their pockets tremendously. That cost will continue to escalate, and most of these Medicare members, again, cannot afford those uncontrollable rates of these medications without coverage. So what the system did is basically they designed a process that will basically force the Medicare beneficiaries to choose a prescription coverage, so that way they don't have to suffer financially for the high cost of medication. So yes, so if they don't choose a Part D coverage within a certain time frame that they are eligible for, then yes, there will be a penalty attached to them. And the penalty is usually 1% of their base premium. Okay, so as you can see here, it was 1% of the premium that they're paying for Social Security. So last year, or this year, I should say, that's actually roughly comes out to about $33.37, which is the penalty that they will have to pay if they don't choose the Part D. So it is definitely very important information, and it does affect financially each one of these members if they don't select and enroll into these required programs. Okay. Okay, so I'll skip the annual stages. Extra Help, again, is a different program sponsored by Social Security, and it's traditionally called LIS, which is Low Income Subsidy. And basically, it is a program that works mainly with the income level. So they look at the application, and they're going to look at what the income level is of that applicant. And again, if you meet the income criterias for this program, you could then get different levels of discount assistance for your prescriptions at the pharmacy level. So LIS has different tiers. It has like from tier 1 all the way through tier 4. And depending on your income, you could fall into one of those tiers. If your income is too high, then you will not qualify for this program. So again, this program is specifically designed for low-income individuals to help them with the cost of medication, okay? And then you have other programs like EPIC in New York and other state pharmaceutical programs. Each state has a version of a state pharmaceutical program. And again, that's an action requirement as well to the member. The member will have to apply directly, or their sales agent or the health agent that works with them could apply for them in their individual state so they could receive assistance and further discounts for their medications. Okay, those programs are available. In New York, the state pharmaceutical program is called EPIC, EPIC, and it's a fantastic program. The income levels are pretty high, and those are now increasing for 2023. So almost any Medicare beneficiary will qualify for, a lot of them will qualify, not everyone depending on income, but you could make up to $89,000 a year and still qualify for that program. And now, again, that income level is going up to over $100,000 a year. So it does make the availability affordable for many members of that population.
And Race, talking
Yeah.
about Part D as well, so it helps to cover the cost of the medications, but do you still have to pay any copays?
For Part D,
Yeah.
yes. If you get Part D by itself as a standalone plan, then yes, you will have to pay the premium for that package, which varies anywhere between, I would say, $20 to $50, depending on the plan. So you will have to pay the premium of that package, and yes, you will have to pay the co-payment levels depending on the tier of the medication. Okay, so yes. Now, if you are enrolling in a Medicare Advantage plan, the Part D is already included in your plan. And in most cases, if you are choosing a zero premium plan, then you don't pay a premium for that, but you're still responsible for the copayment depending on the tier of the medication. And again, the copayments vary, but tier 1s and 2s, which is the generics, usually $0 through $3 or $0 through $6 for tier 2. Tier 3s usually, from $8 or $9 all the way to maybe $20, and so on and so on, depending on the different tiers. If you sign up for a program like Epic, for example, then the good thing about Epic is that it gives you a fixed tier for your premium cost, and you pay a fixed premium for that package. So your medications will always be at that rate. So you will not pay no more than $20 copayment, regardless of the medication, as long as you're paying the annual premium for the Epic program. So it does allow a lot of discount flexibility for individuals that are taking a lot of medications, or individuals that really need assistance with medication cost. So that's what that program is designed for. Okay.
Thank you.
Okay, very good. So again, finally, the Part C is Medicare Advantage. When most people say, well, what's Part C of Medicare? It's the Medicare Advantage portion of Medicare, and that's where all the carriers come in. So all the health plans that are providing Medicare Advantage plans, that's basically Part C. Part C combines Part A and Part B, and in most cases, it includes a Part D also, and it's actually a program designed to fit all these different coverages into one Medicare coverage. Okay, so it is a managed care network. You have to choose a primary physician. And again, in most cases now, I know here it says you will need referrals to see a specialist, but that has changed dramatically over the years. Most Medicare Advantage plans now don't require referrals to see specialists. So it's pretty much more of an open system. As long as the specialist accepts that Part C coverage, then you could go ahead and see that specialist without a referral. Again, the other advantage of it is that most of them are low or no premiums may be available, and not based on criteria, which is really, really good. So again, a lot of people are moving more and more into Medicare Advantage because most of them have low premiums or no premiums at all, and they are a more cost-effective option. They do provide all your medical coverage plus additional added value benefits. And again, the only restrictions for the most part is the network, unless you choose a PPO plan in a Medicare Advantage space. But they are traditionally now getting better and better. Again, I remember when Medicare Advantage first came out in New York, and those packages weren't that attractive. They were very centric to network, only a handful of doctors or hospitals that you could only see, referrals for everything. You couldn't do anything without an authorization or without a referral. It was really a painstaking type of process, because the members had to go through a lot of issues just to get coverage or just to see their doctors. So that was the first wave of Medicare Advantage. It was mainly an HMO network type of situation. But now, throughout the years, it has evolved more and more. There, and now they're actually really, really good. Many of these Medicare Advantage networks are now opening up more and more, a lot more benefits to cover, and the cost continues to be really, really good for the members. So that's always the main thing, is the cost. These packages are very cost effective, and they provide a lot of coverage for less amount of premium. So again, it's a popular choice in today's market, along with the Medicare supplements. Okay. And again, lastly, it does offer added value benefits. It does offer vision, dental, hearing. And again, Medicare supplements do not offer these, and traditional Medicare does not offer these either. So it is a kind of like a one-stop shop coverage where you could get a lot out of your Medicare Advantage coverage for a small amount of premium or no premium at all. You just basically pay your co-payments as you go. Most zero premium plans with Medicare Advantages, then you have cost sharing. You will have to pay a small co-payment to see your doctors, and co-payments to see your specialists, co-payments for the first 3 to 5 days in the hospital, co-payments for ambulance care, co-payments for emergency care, things like that. But no premium monthly. So you basically are using the services as you need it. And that's one of the advantages of Medicare Advantage. Okay. And that's about it with regards to the Medicare Advantage. The last thing is the enrollment periods. We did talk about this earlier, but these are the enrollment periods for Medicare. So I know you asked the question earlier about if a member starts with one package and can they change later on throughout the year if they need a different service? Yes, the answer is yes. So you have your initial enrollment period when you're first turning 65. You have your annual enrollment period, which is coming up now from October 15th to December 7th. The annual enrollment period is kind of like the enrollment period where there's no restrictions for members to choose what they want. Everyone with Medicare is eligible to make any changes they want to their Medicare coverage between October 15th and October 7th. And then you have open enrollment period, which is from January 1st to March 31st. Open enrollment period is kind of giving every Medicare member an opportunity to change what they chose, to change their coverage if they want to make a change. So let's say you choose a plan. If you choose a Medicare Advantage plan in November during the annual enrollment period, but let's say in February you change your mind, you tried it, you went to visit the facility for the first time, you tried the benefits of that new plan, and let's say you just didn't like it, or you rather go back to what you had before, or you just want to make a different change. So open enrollment period allows you to make that one-time change. Okay, so again, really from October 15th all the way to March 31st, again, very limited restrictions for you to make changes. So a lot of Medicare members can make changes during this time, during these 6 months. Then you have, after that, you have the lock-in period. So from April 1st to December 31st, at that point, if you are in a lock-in stage, you are not able to change your plan until annual enrollment comes around again. Again, however, there are exceptions to the lock-in period, and that's where special enrollment comes in. The special enrollment period is the exception to the lock-in. So basically, anyone from April to December, you can, if you have a special election, you could actually change your plan. And special elections vary, but the most common ones are when you move from one county to another. If you have a change of address from one county to another county, or from one state to another state, that automatically opens up a special election period for you, and you can enroll into any other plan you want at the new address. Also, medical conditions. Let's say your health condition changes during the year, and now you need more specialty care, or you need additional medication that your current plan doesn't cover for you. So again, that also gives you a special election exception. So it gives you a special election for you to change your plan. Let's say also your circumstances change, your income levels change, anything like that, that will now put you in a more low income status for whatever reason. Then again, financial circumstances does allow for special enrollments. So there is a number of different categories for special enrollments that people can enroll throughout that time of year, depending on the exception. So again, and there's other programs that will open up special enrollments for you. We talked about EPIC and we talked about low income subsidy. So let's say if you are a Medicare patient and you enroll into one of these discount programs and you get approved for low income subsidy or for EPIC, then the moment you make that application into that system, that opens up a special election for you. So you can change to another plan because you opened up a special election by now being in the LIS plan or by now having the EPIC program attached to your coverage. So these are different categories and different factors that will open up special election periods for you. That's what is called special circumstances within the year. Okay, and there's a list of those. Again, if you go into the Medicare.gov website and you search Medicare special enrollment categories, there's a list there of a lot of different special enrollment criteria that you can qualify for. It's quite a bit. So I would definitely advise anyone with Medicare that is looking to make any changes throughout the year. You could definitely go in there and take a look at what you qualify for and request a change. Okay, and that's it. That's really, we already talked about these items here. The guaranteed issue, the star ratings is just the score that Medicare CMS, which is the Center for Medicare Services, they rate the plans every year. They actually rate all the insurance companies in their performance, in their marketing, in their provider relationships, in their level of care, how well are they caring for patients, et cetera, et cetera. So there's a whole list of criteria that they get graded for. The higher the star rating for the plan, the better performance that plan has. So many members are also look at the star rating just to make sure that their plan is in an acceptable grade. Anything right now, the star rating is from 1 to 5 stars. There's very few 5-star plans. So I would say 3 and 4-star plans are the common range. If the plan you're currently in is less than 3 stars, then I will definitely suggest to look into other carriers with higher star ratings, because that means that they are performing better for their patients. Okay, and that's it. Any other questions at this point with regards to the Medicare information that we put out today?
Well, I don't have any questions at this moment, but I think that this information has definitely been very clear, and thank you for that, and very comprehensive. Personally, I've learned so much today because, again, I was confused from the beginning. That's why I'm like, okay, spell it out for me, Medicare, Medicaid, all of that, because it's hard to understand, you know, and I understand
Right.
that it could be even harder for people in our community because, come on, I work in healthcare. We're supposed to have some knowledge about this, but there are so many other people. But now I'm like, okay, I have worked when I turned 64 to 65, right? Like, I don't think a lot of people know this, and I feel kind of bad with my Latino people because, you know, if you get so many letters in the mail and they are all in English and you don't know what to do, you know, you just end up throwing them out in the garbage and you wouldn't know what to do, and you missed a great opportunity here because who doesn't like to save money, right? So
Yeah,
you
absolutely.
said it, you can continue paying for private insurance and all of this, but even people who have the money, I think, who doesn't like to save. So this is a great information. Thank you so much. All these parts that, you know, yes, you hear about them and it's like way over your head. I think that you made it so clear for us today. So I'm going to be sharing this link so much. I'm sure that a lot of people are going to be looking at this recording. And, you know, if you do look at this recording and if you get this far, where can we reach you if we have questions, or how can we access more information?
Okay, absolutely. And again, I will email you the deck that we just went through so you can have it and share it if you have to. I will put the contact information there. Again, yeah, we via email is mcare1agency@gmail.com. That's that's our email address. Again, website AGA, which is applygeneralagency.com. That's our national website. Our individual local website is mcare1.com. And again, I could type in my phone number as well. We have a 800 number that actually goes into our call center as well. So but you could reach out directly, 347-249-2691. I'll give you all that information on the email that I'll send you. That way you could share it with your network. Again, we do a number of different seminars and events and engagement with information. So there's definitely a lot of different things out there that a lot of members just don't have access to. And that's what we like to do. We like to put that information available. But two quick things before we finish. Just for individuals that are not Medicare eligible. So there are two effective ways, I would say, to kind of shop around for healthcare coverage in the market. I would say the two most effective ways for anyone that does not have Medicare under 65 looking for affordable health coverage. Again, the Affordable Care Act, everyone understands that you could shop at the New York State of Health and actually go into that system and just kind of take a look at all the available carriers and the available insurance offerings that are there. But there's also another network which is called the Impact Health Sharing Network. And I think a lot of people are not aware of that. And it actually gives most people under 65 that are looking for affordable health care, it gives them a whole nother cost-effective option with great coverage all over the country. And I'll send you that information. It's impacthealthnetwork.com, and you could basically go in there, type in your date of birth, and you could get a quote from your state right away to give you credible coverage, great healthcare coverage normally at a lower cost than the Affordable Care Act prices. So those two, I will advise anyone that is looking for their own insurance for themselves, if they're a single independent contractor or a single person or couple, family, small business that's looking to kind of get coverage for themselves and their employees. These are the two best options for affordable care. So again, in every state, is just go into the Affordable Care Act website from your state, and nationally you could go into Impact Health Sharing, and it will also give you another option. So there you have it.
Okay. Is impacthealthsharing.com or .org?
Yeah, impacthealthsharing.com. Yes.
.com. Okay. And can people from every state log into this and look for information, access this information?
Yes. It is a national network, and it's an open network. So it's not restricted to network or providers or anything like that. It's a pretty unique system. We're just learning about it recently. We just contracted with them recently as well. And we're going to start offering that service as well very, very soon to the market, because it's a different option. It's a really good cost-effective option for people that don't have insurance, that don't have Medicare. This is not for Medicare people. This is for anyone else under 65 that do not have Medicare and do not have insurance, or looking for a more cost-effective coverage. So it does give a really, really good option besides the Affordable Care Act.
¿Y si no habla inglés?
¿Cómo?
¿Y si no habla inglés?
También lo puede hacer.
Okay. So we're just saying, you know, if you don't speak English, you can still reach out, you know.
Now, yeah, so I do have a request, because I know it's almost going to be 2 o'clock now, and I know most of the time we did everything in English today. Is there any way that we could schedule the Spanish portion of the orientation?
Absolutely.
Maybe next Thursday?
We definitely need to do that. Yes, okay. we wanna do that, because we wanna reach out to our audience in Spanish as well.
Yeah, because as you can see, it's a lot of information, and I want to make sure that I take my time explaining it. I want to skip everything, you know, in Spanish. I want to be able to be thorough and explain everything as I did in the English presentation. I want to be able to do the same and give the same amount of time and care to the Spanish population as well.
That would be amazing. And I also want to make sure that you guys stay where you are for 20 more years, so that when I have to go through these, I can call you. And I can just say to you, okay, what do I do? Because that's usually what happens, right? When we don't understand, it's like we're closing our eyes and like, tell me what to do and I'll sign, you know. But
and that's why we're here. We're here to help. We're here to help.
Correct.
Exactly. That's great. This presentation has been really amazing. Thank you so much for being here, for your help. And yes, I will touch base so that we can do this in Spanish very soon.
Okay.
Because again, you know, no more blindfolded people signing papers out there and then getting the worst coverage ever. Like, we need to make sure that we get what we need. So thank you.
Okay.
Right. And you have Pam's contact information. Pam will reach out to you as well, and she'll send you her contact information and my contact information. You know, we're from Senior Benefits First, and where we work with NRES, MCare, and AGA. We're all aligned, and you know, I want to make sure that you have our contact information as well.
Yes, that'll be great, because when I send this link, so that other people can see it, you know, I want to send all that information next to the link, so that people who need to reach out, they know what to do.
Right.
Okay.
Excellent. Great.
Thank
you for having us, Sandra.
Thank you so much for your time. And Enroll, thank you so much. It was a great presentation.
Yes, Enroll.
Really,
yes.
thank you so much.
Yes.
Thank you, guys. Have a good day.
Thank you. Everybody have a great day.
Bye.
Bye.
Thank you.